My name is Laura. In January of 2007, I found 3 lumps in my left breast. I had chemotherapy, a mastectomy, and radiation. Here I am receiving a biopsy after my cancer returned in December 2009. I'm a patient, maybe just like you or someone you love. If you've been diagnosed with stage 4 metastatic breast cancer or love someone who has, I hope this information is helpful to you. Just 1 month after beginning chemotherapy during my first breast cancer diagnosis, my daughter Karina, in the pink, helped me walk in the Susan G. Komen Race for the Cure. My mom and my 2 other daughters, one not pictured, also came to support me. Each survivor was given a pink rose in celebration simply for being alive. 1 in 8 women are diagnosed with breast cancer each year in the United States, and in my area those numbers are even higher. Today, 1 in every 100 breast cancer patients is male. The body rejuvenates itself by replacing old dying cells with healthy new cells. In cancer, the cells don't die off and keep multiplying, eventually forming tumors and taking over healthy tissue. Most breast cancers begin in the milk ducts. This diagram shows a healthy milk duct, a milk duct which is beginning to be filled with cancerous cells known as in situ, a precancerous condition, and a milk duct in which cancer cells have broken through the protective boundaries and become invasive breast cancer, or invasive carcinoma. This is when tumors begin to form, and it is possible for the cancer to spread into the blood or lymph system. My mammogram in March 2007 clearly shows the 3 tumors I felt. Not shown is a 4th tumor and a cancerous pathway which connected the 2 smaller tumors on the left of this picture. Breast cancer isn't just one disease, but several, which is why so much research is necessary. First, breast cancer can begin forming in different parts of the breast and in different ways. Again, most cancers start in the milk duct, but it can also begin in the milk lobes. Any cancer that breaks through the boundaries of either the ducts or the lobes is invasive breast cancer, and lymph nodes should be checked during biopsy. Inflammatory breast cancer can look like an infection. Your breasts may become red and swollen with a puckered orange peel effect in the skin. This is sometimes diagnosed as mastitis, inflammation of the breast, so be especially careful if you show these types of symptoms. African American women have high cases of fibroadenomas, benign breast lumps, and are also sometimes misdiagnosed. In men, breast cancer usually presents as a non-painful mass just beneath the nipple, as men do have a small amount of breast tissue. There are also several characteristics to breast cancer, and each determines different treatment. Triple-negative breast cancer does not have any special defining characteristics. This may sound basic, but is not simple. While chemotherapy is used with all cancer characteristics, it is the primary treatment for triple-negative breast cancer. Triple-positive breast cancer feeds off estrogen and progesterone and also overexpresses the HER2 new growth protein, causing it to grow faster and more aggressively. And there are different variations of these characteristics even between tumors and over time. Breast cancer is staged based upon the number and sizes of tumors, whether or not lymph nodes are involved, and whether or not the cancer has metastasized. The stages I have been are in red. It is possible to be originally diagnosed at stage 4, and it is possible to be originally diagnosed at stage 0 or 1 and recur at stage 4. Stage 4 metastatic breast cancer is cancer that has moved out of the breast. Some metastasis can be local, remaining in and around the chest area. It can also spread to your bones, your liver, or your brain, as well as other locations in the body. These are all still considered breast cancer and retain breast cancer characteristics. Ironically, at the time I originally researched this PowerPoint, I didn't realize breast cancer could also spread to your lungs. Stage 4 metastatic breast cancer requires lifetime treatment. This is called palliative care and is the same aggressive treatment used in early stage cancer, but is aimed at extending life as long as possible instead of actual cure. Patients get scans approximately every 3 months to check disease progression and the effectiveness of their current treatment. This is called living 3 months at a time. Approximately 30% of all early-stage breast cancers will recur at stage 4, and up to 10% of breast cancers are originally diagnosed at stage 4. This is why continuous research is so necessary to look for better treatment options and possible cures. There are several existing treatments for breast cancer. Chemotherapy kills the cancer cells during the division stage of a cancer cell's growth. There are special medicines used to treat the overexpression of the HER2 new growth protein, and more are currently in trials. They are also shown on this list. The medicines I have tried are in red. There are even more treatment options for hormone-receptive cancers. Some therapies prevent your body from making estrogen, and some prevent your cancer from feeding off estrogen your body is making. Different therapies depend on whether you are premenopausal or postmenopausal. In stage 4 metastatic cancer, radiation is used to shrink tumors and alleviate pain, especially when tumors are pressing on nerves or in the case of painful bone involvement. Radiation is also used with brain metastasis, as many medicines do not cross the blood-brain barrier, which protects the brain from any various lifetime infections that may enter the bloodstream. Baldness is an obvious side effect of chemotherapy, but in truth there are many side effects related to each of these treatments. The actual side effects and severity of them can differ from patient to patient. Several breast cancer patients try holistic treatments, such as making dietary changes, using nutritional supplements, juicing, and other natural remedies. They may try these alone or in combination with Western medicines. Again, treatment for the metastatic patient does last forever. Approximately 40,000 women and 400 men die from metastatic breast cancer each year. The good news is that continued research brings better treatments and leads to longer lives. During Breast Cancer Awareness Month, there is one day, October 13th, which is recognized as National Metastatic Breast Cancer Awareness Day. This is the day that focuses on metastatic disease. Each year, there are more events working to bring awareness to metastatic disease. If you have been diagnosed with metastatic breast cancer, if you are living your stage 4 life, know that I and others are working hard to make sure that there is awareness of your situation. Awareness that not all breast cancer is easily cured, and we are working to gain funding for research and needs that are specific to metastatic disease. This ribbon is my representation of metastatic disease. Breast cancer, the grayness of uncertainty, and finally, the end of our fight. If you have a loved one with stage 4 metastatic disease, here are some things you should be careful about saying. Do not tell them you're cured. Metastatic breast cancer is never cured, and again, your loved one will remain in treatment even during those times when they are doing well. Compliments are nice, but do not use them as a way to negate or diminish your loved one's illness or their fears that stem from it. You may be tempted to remind your loved one that everybody dies and so they are not alone, but there is a very real difference between knowing you might die and knowing you will die, and just not knowing when. Be sensitive to the fact that your loved one faces that thought daily. But here are some things that you can do and that my loved ones have done for me. Be patient. As time passes, as treatment and eventually cancer progresses, your loved one will become less reliable to you because they will become more tired, more weak, more ill, and in more pain. Be open to discussion. Just as everyone talks about the important things in their lives, cancer is not only important, but a primary consideration in your loved one's life. If your loved one needs to talk about the aspects of cancer that are less than positive, such as fear, sickness, and death, be open to them. It may be uncomfortable, but your loved one needs to process many frightening things about their cancer, and a loving friend or family member can help them as they plan their uncertain future. Continue to visit them. And remember, they still love you even if they don't show it the same way they used to. Thank you so much for watching this PowerPoint video. Again, I am not an expert or a professional, but I hope this information has helped you. If you or a loved one has been diagnosed with metastatic breast cancer and there is not a support group in your area, you can find one online at inspire.com Metastatic Breast Cancer Community. And please know, my family and I are wishing you well and praying your treatments work well for you.